Hello everyone, I am Dr. Srikar Vijayasarathy. I work as an assistant professor in the Department of Audiology at the All India Institute of Speech and Hearing, Mysuru. So till now, we have gone through how different parts of the ear function and what may cause different forms of hearing loss. We have also gone through some of the basic tests of the ear. In this module, we will go through a few advanced tests of hearing. So, these are referred to as physiological tests. So, what are physiological tests? These tests are tests of function. So, the key idea is that they do not require voluntary participation from the patient, that is they do not need to raise their hand, indicate by their fingers that they heard. So, these tests are crucial for hearing testing in infants, small children as well as in adults for further confirmation of the results. The first test that I would like to discuss is the Otoacoustic Emission or the OAEs. So, this test is a test of inner ear function or the cochlear's function. So, if the cochlea is functioning fine, we can record that activity in the ear canal. So, sounds of different frequencies can be given and their echoes from the cochlea can be recorded in the ear canal within 2 minutes to know the functioning of the inner ear. So, if there is a problem, there will be no or very low energy otoacoustic emissions, leading us to suspect that there is some form of hearing loss. Worldwide, this is the primary test that is used in newborn hearing screening, whose aim is to test all newborns before they are discharged from the hospital. The next test that we will be discussing is the Auditory Brainstem Response or the ABRs. So, when a sound is given, it goes from the outer ear to the middle ear to the inner ear, and after that it goes to the nerve and higher structures and finally to the brain. That is where we hear sound. So, another way to test the function of the ear is to look at how the nerve is responding whenever a sound is given. So, we can attach wires behind the ear on the head, these are called electrodes, and from that we know how the ear is functioning. With automated ABRs, we can assess the hearing function within 5 minutes in a hospital setup. ABR is also used in adults to identify different kinds of nerve related problems. So, otoacoustic emissions or the OAEs and auditory brainstem responses or the ABRs together represent the most frequently used audiological tests in infants and in children. The final test that I would like to discuss is the tympanometry and wideband emittance tests. So, if there is a pathology or a problem at the level of the cochlea, we have the otoacoustic emissions or the OAEs. If there is a pathology or a problem at the nerve level, we have the auditory brainstem responses. What if the pathology is earlier? Okay. What if it is there at the level of middle ear? So, for that we need a specific test. So, the idea is that if there is a problem at the level of the outer ear, we can easily see that. So, if there is a problem at the middle ear, we have these particular tests. These tests, like the otoacoustic emissions, deliver sound in the ear canal and measure how much of the sound passes into the middle ear and how much was reflected back. If there is no problem in the middle ear, most of the sound will smoothly move into the middle ear, and if there is a middle ear pathology, sound will be obstructed and most of that sound will just be reflected back. From this, we come to know if there is a middle ear issue or not, like some discharge in the ear, hole in the eardrum, breaking of the bone in the middle ear, etc. So, these three tests, the otoacoustic emissions, the auditory brainstem responses and tympanometry measures are the most commonly used physiological tests to assess the function of the ear. There are many others, Okay, but these form the basic physiological tests that we use frequently. A key idea is that these three tests give different kinds of information. So, we administer all these, collect information from all these and then arrive at a diagnosis. So, this is called test battery approach. So, this is why we have so many tests to see how the ear is functioning. So, thank you. I hope this short module was interesting. Good luck with your learning.